Good morning. I am Dr. Malik. Today we are going to discuss about a topic called dawn phenomenon. Dawn phenomenon. What is dawn phenomenon? See, when you are reversing your diabetes, when you want to reverse your diabetes, so many people are interested in reversing their diabetes. People are tired of diabetic complications, so they are trying to reverse their diabetes by diet and exercise. 80% diet and 20% exercise. They are trying to reverse their diabetes. And one more, see, this dawn phenomenon is common for everyone. It's common for everyone. It is seen very profoundly in some people, particularly people who are reversing their diabetes. You can see this. What happens is, fasting blood sugar levels are little high. Fasting blood sugar levels are, the moment you get up from the bed, when you check your sugar levels, the sugar levels are little high. Say 120, 125, 130 or even 140, to some people 150 also. But after your breakfast, they are going to come down to 120, 130. See, your fasting blood sugar levels are high, and your post lunch or post breakfast, whatever it is, after food you are doing your blood sugar, it is less, it is normal. So why the fasting blood sugar levels are high in some people, particularly people who are reversing their diabetes, and in normally also in some people the fasting blood sugars are little high and post lunch are normal or little less. For example, fasting is 140, post lunch is 120. This is little abnormal, isn't it? You see in most of the people. So why? Because the main reason, this is called dawn phenomenon. Why? Because actually what exactly it means is high sugar levels in the fasting period. Why it occurs is because of hyperinsulinemia and hypoglycemia. What happens to your blood sugar and insulin in the night? You sleep in the night after having some dinner. Okay, at around 1 o'clock, 2 o'clock, the insulin action is peak. The pancreas secretes so much of insulin so that your sugar levels drop to hypoglycemia level. Your sugar levels become very low. The low sugar levels in the body stimulate some hormones called cortisol or glucocorticoids. These are steroids. Cortisol, glucocorticoids, which are there in the body, which are natural steroids, and glucagon, another hormone. Epinephrine or norepinephrine, it is another hormone. Growth hormone also. All these four things are stimulated by your low sugar levels in the midnight, that is at 1 o'clock, around 1 o'clock, 2 o'clock, your sugar levels drop to a critical level where your body steroids respond, glucagon, another hormone responds, epinephrine, norepinephrine, another hormones respond, and your growth hormone also responds. All put together, they increase the sugar levels. In the body. These hormones, they raise the sugar levels to that 140, 130 level in the morning when you get up. Midnight, it was very low. Your insulin, the secreted insulin by your pancreas, by its overaction, because you are giving so much of carbohydrate, easily digestible carbohydrate. You are giving so much of easily digestible carbohydrate to the body, so that the pancreas is working more. And naturally it secretes abundant insulin, causes hyperinsulinemia and hypoglycemia, responding to hypoglycemia because of hyperinsulinemia. Okay, then with this the other hormones get stimulated and they cause hyperglycemia. They release glucose from the body, from liver, from adipose tissue, etc. The body glucose is secreted into the blood. The body glucose, when the critical glucose level falls in your blood, all the hormones get released, and they release from your liver, adipose tissue, etc., muscle, etc., etc. By gluconeogenesis, they make your sugar levels high. All these hormones are responsible for your high sugar levels in the body, by various mechanisms like gluconeogenesis, etc., etc., glucagon. For example, there is fat in the liver which is converted to glucose. There is some fat in the muscle which is converted to glucose, or protein in the muscle which is converted to glucose. By all this, and the key role is all these hormones are going to act. This is called dawn phenomenon. So your fasting glucose levels are high. So even for me, when I started reversing my diabetes, this happened to me. Even yesterday when I checked my sugar levels, it was 126 fasting, and post lunch it was 110. So fasting 126, post lunch 110. It is a little abnormal, isn't it? Yes, it takes time. So for the fasting blood sugar level to be normal, for the fasting blood sugar level to come down to normal, it takes time. It may take 6 months to 1 year. But what are you supposed to do for this? To get the fasting blood sugar level low, what are you supposed to do? Number one, don't eat. See, night you should not eat carbohydrates as much as possible. Reduce the carbohydrate intake in the night as much as possible, and fiber rich carbohydrate diet only, little bit. Then increase your protein, increase your fat in the nights. Increase the fat content, increase the protein content of your food in the night, and little carbohydrate, very small amount of carbohydrate you try to take, that too with lot of fiber, so that the food which you have taken in the night doesn't get converted to glucose very fast. It gets converted to glucose very slow, because from fat, conversion to glucose is very slow. From protein, conversion to glucose is very slow. Only from carbohydrate, the conversion to glucose is very fast. And your insulin, your pancreas, hyper responds, over responds, mainly if you are taking carbohydrates. So reduce the carbohydrate content, take protein, take fat more in the nights. So this problem doesn't occur, and it doesn't go overnight. It takes time. And one more thing is, it takes 6 months to 1 year to get the fasting blood sugars to normal. So nowadays all the cardiologists, when I was a medical student, 80 to 120 in our biochemistry books, we used to see 80 to 120 milligrams is normal fasting blood sugar. But now all the cardiologists, they say you must maintain the fasting blood sugar below 100. So please try to maintain your fasting blood sugar. Don't exceed 100, but not in a single day or other. It takes time. It may take 6 months or even 1 year to get to that level. So don't get frustrated. This is not an abnormal thing. Dawn phenomenon is not an abnormal thing. It takes little time to get to normal. So, and one more thing is, if you are doing exercise regularly, particularly if you have got high fasting blood sugar, don't do exercise in the morning. Try to do exercise in the evening. So that exercise also produces some hormones like epinephrine and norepinephrine. All the hormones, growth hormone, etc. are released by exercise. They also cause a spike they also increase your sugar levels. So try to do exercise in the evening for some days, for some months, so that till your fasting blood sugar comes to below the 100, below 100. Try to do that. It is a very important thing, but don't get frustrated with this. See, it is not dangerous. It is not dangerous. It can occur with normal people also, it occurs. But the only thing is, it should be reduced to below 100 level over a period of time, maybe 6 months or 1 year. Take your own time. Try to follow these guidelines. Particularly in the night, try to eat less of carbohydrate, least carbohydrate, good protein, good fat in the nights, so that food gets slowly converted to glucose. There is no sudden hypoglycemia and there is no hyperinsulinemia, so that the pancreas doesn't overact. If carbohydrate is there, it overacts. So if you are taking fat and protein, it slowly acts. It works like a white-collared man. Your pancreas works like a white-collared job. Okay. Otherwise, it becomes a manual labor. If you are taking carbohydrate, it becomes a manual labor. That is the difference. So try to reduce, try to follow these things. Particularly exercise, try to do in the nights. When you come back from your office or you work, try to do in the nights before going for food. That is also a good way. Try to avoid exercise in the morning if your fasting blood sugar levels are high. Try to do this. These are very, very important tips, but not dangerous. Try to follow it.